You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of Disease du Jour. I'm your host, Carly Sisson, and in this episode, I spoke with Dr. Christine Staten about heat stress and heat stroke in horses. The Disease du Jour podcast is brought to you by Merck Animal Health. Dr. Christine Staten is a native of Tucson, and after an earlier career as an OBGYN technician, she attended and graduated from Colorado State University School of Veterinary Medicine in 1999. Dr. Staten joined Dr. Page in 1999 as a part of Tortolita Veterinary Services, a large animal ambulatory practice. In 2005, together they built a new mixed animal clinic on the east side of Tucson called Adobe Veterinary Center. She is an active member of the Southern Arizona Animal Cruelty Task Force. Although she enjoys all aspects of large animal medicine, she has a particular passion for endocrine disease, dentistry, reproduction, and preventative medicine. She prioritizes owner education and believes it leads to healthier medicine. At the age of 50, Dr. Staten went back to school for her MBA. She then founded Veterinary MBA, which provides real-world business education and resources for veterinary practice owners. Thank you, Dr. Staten, for joining us today.
Thank you so much for inviting me. This is going to be exciting.
Yeah, I'm really excited for our discussion. Can you get us started by explaining the difference between heat stress and heat stroke in horses?
Yeah, I'm in Tucson, Arizona, and it is hot here, but it is not incredibly humid here. So we see some heat-related issues, but not exactly as much as what people see in some more humid areas. And I guess I divide it up when I'm talking to clients. I explain to horse owners that heat stress is something that the horse is compromised, but as soon as you stop doing the things you're doing, the horse recovers pretty much normally. We can help them recover, but the owner can probably get them into a healthy spot again. So they're going to look like when they're stressed, it's kind of an exhaustion, heat exhaustion. They're going to maybe have some sweating abnormalities. They might be physically warm when you're touching them. They're certainly breathing faster. And if you took their temp, they'd have a high body temperature, rectal temperature. They might have some signs of dehydration, which we see mostly as their gums are sticky. And they might even be weak or kind of staggering around a little bit. But those guys, when you stop doing what you're doing and you cool them down pretty quickly, they return to normal. Whereas when we're talking about heat stroke, what we're really dealing with is a horse that needs significant help to get better. And we can't just quickly stop their exercise and they start to recover on their own. Their body physiologically is very stressed and can certainly lead to death. And so what we want to do is take heat stress very, very seriously so we never get to that heat stroke situation. So we treat all heat stress aggressively. And even though some of them might have gotten better on their own, we don't know who would have gotten better. So if they're not recovering quickly, we definitely want to intervene and get involved to prevent them from getting into that heat stroke situation.
So how often do you encounter both of these conditions in practice, and what are some of the risk factors? I'm sure for you it's much higher than veterinarians practicing in other parts of the country, but you probably know better than anyone what the risk would be in a hot climate.
Yeah, I may give you a very disappointing answer here. Because we are typically dry, we don't see a lot of heat stress in horses. We actually see a lot more heat stress in the rider. If people try to go on a hot ride in the middle of the day, the horse actually does significantly better and the rider can get very sick. We have had people die from heat stroke, whereas the horse is doing well. And that's because here we have low humidity. And so we talk about this heat index when we talk about horses and heat stress. And if you add the temperature outside to the relative humidity, and that number is high, if it's over 150, the risk of having a heat-related problem in a horse is extremely high. And then as we get below 150, we still have some benchmarks that we want to be protective of. But in where I happen to live, where it's typically dry, Our humidity is generally in the single digits. We are never going to hit that heat index that we worry about of 150 total put together. So I think people in very humid climates, if you have a temperature of 100 and a humidity of 50, you are in a big danger zone where we don't see that as frequently. Now, I say that, but we are in our monsoon season where we do have about 4 to 6 weeks of humidity. It kind of wavers throughout the day. And this is where we are most concerned about horses and heat stress because we have our humidity up, so that relative heat index is higher than we're used to.
Today's Disease du Jour podcast is brought to you by Merck Animal Health. The maker of prestige vaccines, Banamine, flunixin-meglumine, Panacur, fenbendazole, Regimate, Eltrenagest, Protozel, 1.56% diclazaril, anti-protozoal pellets, and other trusted equine health solutions, Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as our unconditional investment in our industry, profession, and community through programs such as the Respiratory Biosurveillance Program and unique solutions like biothermo temperature sensing microchips. Visit MerckAnimalHealthUSA.com for more information. Do horses become acclimated and become less at risk if they're in a hot climate year-round versus a horse that maybe moved from a colder climate to a hot climate? Would that increase their risk, or is it like any horse that's working in hot conditions is equally at risk?
I definitely think that horses that move to a warmer climate are at a higher risk. The ones that I have treated, the most severe ones, were all animals that arrived here right at the beginning of our summer. So I think my experience will tell me that acclimation is really, really important for horses, so that they're, especially how they grow their body coats. And I mentioned that we don't see a lot of heat stress directly related to the temperature. That's in healthy horses. We absolutely see heat stress in our compromised horses. So a morbidly obese horse is going to be at a higher risk for heat stress in our environment. A horse that can't sweat. So, or those horses that have Cushing syndrome that might have some sweat abnormalities because of that, or they may have sweat problems that's called anhidrosis, where they're not sweating for other reasons. Those horses that can't sweat, they are for sure going to have some bigger issues than a healthy, happy horse in our environment, for sure. And I would say in any environment. So those horses even need more acclimation. If you've got let's say an older horse that has Cushing syndrome that's not really controlled, and they live in a cool, dry area, and you're moving them to a warm, humid area, they are going to need a lot of help, and acclimation might not be enough for them. They're probably going to need more management of their actual disease process and the lack of sweating that they're doing.
So would you consider heat stress to be a true emergency? And how would you start to manage a horse that has heat stress to prevent it from progressing?
Yeah, that's a great question, because as an owner, you don't want to call the vet if you don't need the vet. And some of these heat stresses don't. I say anytime that the horse is showing visible signs of impairment due to heat, so anything, your vet should be on the way. Now, they may get significantly better in 10 minutes, and then you don't need them to come out, but we want that vet on the way, and absolutely we would call that an emergency. It can progress to a heat stroke very fast, and it's hard to tell which ones are going to get better and which ones are going to go into that more fatal, life-threatening heat stroke. So it's like a colic, right? Some horses are going to have a mild colic that resolves. Probably your horse has had a colic while you're at work once, and it resolved before you got home. But we don't know which ones are going to resolve. So we don't want an owner to watch a horse that's colicking or even try to medically manage them and see if they get better, because if they don't get better, we are in a much more dangerous spot, potentially life-threatening. And that's with colic, but that's the same with anything that we're seeing on these guys. And heat stroke and heat stress are definitely going to be things that we want to call an emergency, get it on the way there, and we'd rather treat one that may have gotten better than not treat one that was going to die.
So, what signs would indicate that a horse's condition has progressed to heat stroke?
So in heat stroke, we're going to be looking at even higher respiratory rates. Generally, those body temperatures are going to be over 106 degrees when we take a rectal temperature, and they can collapse. They can be pretty non-responsive. They can have convulsions, and certainly they can die. And those are very, very hard to turn around. It's just challenging because the things that are being compromised in that body aren't just, it's not just hot. It's not just a fever. They really have a lot of physiologic compromise that's going on. And turning that around is really, really hard. And you asked about treatment, which I'm not sure I answered. So this might be a good time to talk about how we treat these guys.
Yeah, if you could explain like the treatment options when the horse has heat stress compared to the treatment options once the horse has heat stroke, I think that would be a great clarification.
Sure. And I think they're pretty similar. Our prognosis is what's better if we catch them early in that heat stress. So we want to cool that animal down. And we're going to tell you on the phone as an owner, if there's an owner involved, we're going to get that owner hosing that horse down with cool water. They've even shown that ice is totally fine to use on your horse. So what a lot of people do is put that hose on the rump and the back. And really, although that's okay, that's not where their blood vessels are close to the surface. We want to put that hose, get them all wet. Absolutely. That helps with evaporation cooling. But then really focus the hose on where those large vessels are so that if we can cool blood, that'll take it to the core of the body. My favorite ones are the inside of the legs. We all can go out and stare at our horse right now and see a large vessel on the inside of all four legs. If we can just stick a hose on that vessel, a really cold water hose on there, then the blood going by is getting cooled and going right to the core of their body. So our goal is to cool them from the outside. When we arrive as veterinarians, we can hook up IV fluids that are certainly cooler than their core body temperature. We're not running cold fluids, but the temperature of the fluids that are going into their body are cooler. So that's one thing we're doing. The other thing we're going to do is probably add some electrolytes in there because typically these horses have sweat out a lot of electrolytes. So we really want to replenish that fluid that they've lost. We want to replenish the electrolytes that they've lost. We want to help them get more stable and feel better. And I think this is an analogy we can't say for sure, but I think a good analogy is somebody who has a hangover generally is dehydrated. And if we can hydrate them, a human that I worked in human medicine for a long time, really all those people need that are super sick is hydration. And then they feel a whole lot better. So we're treating the heat issue, but we also really need to get them feeling a lot better and fast because we want them to eat, we want them to drink, we want them to move appropriately, and we need to help their body physiologically. So a big part is putting fans on them, making sure that get them in an area that has good ventilation. We're not going to be doing this in a hot box stall. We're going to give them access to water. They can drink water. It's totally fine. Don't be afraid to give them cool water to drink. And then the thing that we're doing differently is we're monitoring them and we're generally setting that IV catheter. And there's other things that we might do if they're, down on the ground. We may need to help them with some anti-inflammatories. If they have a secondary problem, we may need to help them with that. But it's really about physically cooling them down from the outside and the inside.
So, what does the recovery process look like specifically for horses that have recovered from heat stroke? And what is the general prognosis?
Well, I think I'll answer with heat stress, not to avoid your question, but I don't know that I know that in 25 years of practice, I personally have not treated a horse that was down and convulsing and completely collapsed from this. So I would say their prognosis for getting them saved in that situation, I would guess is pretty low, unless you have access to an ice bath and some things that can cool a little bit faster. But still, we've got some major changes that may have happened, especially if that core body temperature has been over 106. So I don't feel like I necessarily know that answer. Heat stress, they do great. If we can cool them down and get them feeling better, that can happen very quickly. That can happen within an hour easily. And we've avoided the risk of them jumping into that heat stroke situation.
Do they require any supportive care afterwards? How quickly before it would be safe for the horse to return to work or, return to his daily life without extra support and caution?
Yeah, that's a great question. And I think we start with saying what caused it? What caused the heat stress? And how do we avoid that in the future? Now, it may be super obvious what caused that heat stress. It may be that they haven't ridden this horse in forever and they ran it around in an arena on the hottest and most humid day of the year, and they won't do that again. That horse is going to do fine and its recovery is going to be fine, and their return to work is probably going to be fine as long as they're hydrated and we've replenished those electrolytes, which literally can happen the day of. So the next day, I would say they could be fine. The horse that we don't know why it happened, that's a horse that we are not going to risk stressing again, and we're going to try to figure out why. So is it that they don't have shade and they need a shade structure? Is it that they are in a barn that's poorly ventilated? Is it that they were transported? Maybe we shouldn't be transporting them in the middle of the day. Is it because they're fat? Is it because they have an endocrine disease that makes it they're more susceptible? Is it that they can't sweat? So I think the initial plan is stabilize the horse. The next plan is let's come back out tomorrow and kind of go over what's going on. I'll recheck the horse, make sure he's good to go back to work, and let's figure out what we need to do. A simple solution for a horse that has Cushing's syndrome, let's say, so they're a fuzzy old horse that has uncontrolled Cushing's, is first let's check and see if they have Cushing's disease, and if so, start treating for it. But also, we're going to now probably shave that horse because it's fluffy. We're going to get as much hair off of it as we can so it can stay cool. We're going to put fans up all over it. I've had clients that have purchased portable air conditioners that they have put right outside the stall door, or we prefer it outside. We're going to get regular, normal fans up everywhere to create breezes. We're going to hose that horse down frequently until we can get that disease process stabilized. We're going to give them medications to hopefully help them sweat, or other treatments that may help get them sweating appropriately. So it really depends on the horse and the situation when they can go back to work. That particular horse I just described isn't working this summer. Like, we have got to take the whole summer to get this horse's endocrine problems under control so that we don't risk putting it into heat stroke.
Yeah, that's great advice. And do you have any other recommendations for how veterinarians can help horse owners reduce their horse's risk?
Sure. I think in most cases, it's just changing what we're doing. I think that we are not dealing with the scenario I described before as frequently. If we've got a horse that has Cushing's syndrome, which is the number one thing that we see heat stress in, is cushingoid horses that aren't controlled, we're also dealing with a lot of other problems that horse has, or risk factors that it has. So I'm not saying you can't ride any horse ever during the summer. I don't think that I've ever told anybody that, but we have to control the problem. And so if it's an uncontrolled problem, it could take a while to get it controlled. Now, some horses respond very well to some products out on the market for getting them to sweat, and immediately they start sweating. They're fine. We're going to get control over their Cushing's syndrome, but you can ride them because we got them sweating again. Other horses, we're just not getting them sweating, and it is not safe to ride them. So the conversation with the client is very specific to their horse, their situation, and what we need to do for that horse to get it into a safe place. Typically, we just need to change how they're doing it. We're going to ride in the morning and the afternoon. In the morning, dawn and dusk. We're going to pick the times of day that make the most sense. We're not going to ride in the middle of the day. We're going to take slower rides. We're going to change the environment a little bit and then get them back on their horses riding where they need to be.
Great. And do you have any recommendations for ambulatory vets who are working in hot climates? Do you have any specific equipment or medications that you like to keep on hand in your truck in case you encounter this situation?
Yeah, I thought your question was actually about to ask about the people. I am more worried about my team members out, my technicians and doctors out in this heat than I am the horses, because our horses are so wonderfully acclimated. So what do we keep on the truck? A lot of fluids. We keep a lot of electrolytes this time of year. We go through more fluids in these 6 weeks than the rest of the year combined. We are prepared. And that's really it, is a lot of fluid therapy. Obviously, also, we're going to discuss trying to find the cause of it, which doesn't require additional equipment. So I don't think there's a lot. I think that most of the things that I have used, I can have the owner go get. So go get a bunch of ice at the store or bring a bunch out from the house. Putting a blanket on your horse is not a great thing to do. Even some of the sheets, not a great thing to do. It can trap heat. I do think that briefly, I have had success with taking a bed sheet, which again is at the owner's house, dumping it in ice cold water, laying it over the horse briefly to act as kind of a evaporative cooler can help. But again, it's not something that I need to be putting on the truck. It's really grabbing stuff that's around us. The IV catheter and the IV fluids going in to cool them at the core is what we're out there to do in most cases. And we're evaluating their neurologic status. We're evaluating is anything damaged. If it was really bad, the next day we're probably drawing blood to see if any of the organs were damaged during this.
Do you have anything else that you want to add on the topic of heat stress and heat stroke before we wrap up?
I would say that there are horses that do fine and you can ride them year round. We have a lot of dude ranches down here, and those horses are solid. They are riding in the middle of the day. People are coming into these dude ranches and want to ride. We're much more concerned about the rider than we are the horse when they're going out on these long trips. So I think there is a huge part of this that is about acclimation, and I don't want people to think there's certain times of the year that they can never ride. The only other thing I think I didn't mention is if you're concerned, there's things you can do because dehydration is part of heat stress. Watching their urine and seeing if it's dark or more concentrated or it smells more. We may be moving towards a dehydration situation, and it may be heat related. We can see that happen any time of year, but we do see it more frequently this time of year. And so providing multiple containers of water, never just one. I like one in the shade. I like one in the sun. I like them wherever they want around the pen that the horse hangs out. I like you to throw ice in it part of the day. You can throw treats in it for, we put carrot tops. We get them at the grocery store for our horses, and we just throw the carrot tops right into their water. So they go over and eat the carrot tops, but they're getting a little more water. Keeping them hydrated, watching their hydration can really help it progressing into anything where the veterinarian needs to get involved.
Well, that's great advice. And thank you so much, Dr. Staten, for joining us on this episode. And thank you to our audience for listening. And a very special thank you to our sponsor, Merck Animal Health, for allowing us to have these conversations. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com. That's CSISSON@equinenetwork.com.